Senate File 278 deals with the licensure and transparency of the pharmacy benefit managers, or PBMs. A pharmacy benefit manager functions as a middleman between the drug manufacturer and the health carrier or the pharmacy. Initially, they were hired to make deals with the manufacturer, buy in bulk and get the lowest prices for prescription medications, and pass that price down to the patient. Unfortunately, in many cases, that is not the case anymore. So what is happening now is that the PBM will go to the manufacturer and say, I will put your drug on the formulary, which is the list of medications that gets to the patient, and I will keep your competitors off of this list, but I will need a incentive to do that. And so they get what we call a kickback. And that can be a flat fee, or it can be a percentage of the drug that they place on the formulary. Because of this, in order for the manufacturers to keep their profit margin, they have to increase the price of the drug. And because of these incentives, PBMs can also choose more expensive drugs to put on the formularies, choosing brand name drugs versus the generic drugs, which of course increases the price of the drug for the patient. These practices have only been intensifying over the last several years, as we now have a system that has been monopolized by only 3 PBMs, who own now over 75% of the business. These 2 practices have 2 significant outcomes. One is cost, like I touched upon already, and the second result, which is most important to me, is the medical outcomes. When a formulary is changed, the patient has to start a new drug. This means that medical decisions are being made not because they are medically necessary, not because the doctor wants them to change, not because the patient wants them to change, but they are being made for monetary reasons. When a medication changes, patients now have to come back to the office for repeat blood work to make sure they're not having new side effects, to make sure the medication is working. They have to miss work and potentially need child care. Of course, this increases the cost of health care as a whole. PBMs are essentially making some very big medical decisions that directly impact patient care in the state of Minnesota, and they're doing this without any oversight. So one of the many things that this bill will do is to license PBMs. Nurses, doctors, manufacturers, hospitals, everyone is licensed to practice in the state except for the PBMs. This bill will require transparency in the dealings of the PBMs. What rebates did you get? How much were you charged for that drug? What did you pay the pharmacy for that drug? Where is the money going? This bill will prohibit PBMs from shortchanging pharmacies, which are really impacting our family-owned pharmacies in the state. They'll prohibit PBMs from charging a patient a higher cost at the point of sale, will allow patients to synchronize their medications, which will make their lives easier, and will allow the pharmacist to discuss cheaper alternatives with the patient. This is a really great bipartisan bill. It will bring accountability and transparency to a very obscure player in our healthcare system. It will put pressure on PBMs to have more fair dealing practices and will bring down the cost of prescription drugs. I ask for your support.